to receive an order, and then once I do that, I will communicate with the nurse what I'll be doing so she's not shocked when she comes in and sees a patient extubated. And then I will make sure I gather my equipment, and for extubation I will need my stethoscope to check. I'll need a yanker, which is a yanker, and then I will need a suction catheter, a syringe, and then scissors in case there's tape on the patient and we'll need to cut that, and then an oxygen device system. And I have chosen the nasal cannula today. So, and then after that I will wash my hands, and I will put on gloves. And as I'm doing that, I'll make sure that I come in and say, "Hi, Mr. Jones, I'm Casey Creswell. I'm a respiratory therapy student, and I'm here to take out this tube of yours so you can breathe on your own and eventually get better so you can go home." I'll do that. I'll explain that to him. I'll put him in a semi-Fowler's position. Then I will check his vitals, and I will assemble, make sure my nasal cannula is ready to go. So as soon as I extubate, we can put that on him, like so. And then I will hyperoxygenate him. And, well, before I hyperoxygenate, I'll see if he needs to be suctioned. And Mr. Jones doesn't need to be suctioned today. So I'm going to go ahead and yanker his mouth, get any of those secretions out. And then I will also use my catheter suction to go into his mouth and try to get down above the cuff and get anything that we do not want into his lungs out. So after that, I will make sure I have, after that, so he's ready to go, then I want to check to see if there's any air leaks before I extubate him. So I'll deflate the cuff, and as I'm doing that, I'll plug that ET tube, and I'll feel or hear hopefully air moving, and then I will stop that and reinflate the cuff. And then I will cut the tape if I have it, or I will start to remove this so it's ready to go. So that's ready, and then I will want the patient to take a deep breath for me, and then have him take a deep breath for me. I will deflate the cuff, and then have this off. And as they're taking a deep breath, I'm just going to have them cough as I pull the ET tube out and follow their natural curvature. Then I will have my nurse right by the side of the bed, ready to go, putting the nasal cannula on and yankering real quick if needed. There we go. Mr. Jones, you're doing great. And then I'll encourage him to cough, and then I'll just assess him and make sure everything's okay and make sure that he's able to breathe on his own. So I'll just want to listen, like so, to his trachea, around his chest, so. And I just want to make sure that there's, I want to rule out that he's not like aspirating, or there's no glottic or subglottic edema. And then I will check his vital signs, his blood pressure, heart rate, blood pressure, respiratory rate, SpO2. I'll look at his respiratory patterns, and then his general appearance. And then Mr. Jones is doing great today, so then I'll inform the nurse the time of the extubation and how he tolerated the procedure, and I'll make sure I document it, and then I will evaluate if he's going to need any bronchial hygiene. And Mr. Jones is not right now, so he's doing great. And that is it.